be a recurring theme, at least recently, with some of my clients, that they're very set on wanting structure in their goals. And like they come in initially with pain, they get out of pain quickly, even in some cases, but they're like, okay, well, where do I go from here? Like, show me what the end game looks like. And them really wanting kind of answers to that.
Yeah, I feel like that's a really common thing. It's not even just like the structure of like the end game, but also like once I'm feeling better, it's the question is, do I stop, or like what's the next step? And I feel like that's a very common thing with almost everyone coming in, like why would I keep going if I feel better? So right off the bat, I'll say just because you're feeling better doesn't mean everything is good. One of the main things we want to do is focus on not just feeling better, but quality of life, in the future as well. So it's not just about feeling better, but also making sure that you're making this part of a lifestyle, just like if you're going to the gym or doing yoga or clean eating or whatever it is that your niche is, whatever into fitness you are, or health you are. This is a lifestyle. It's not like a Band-Aid. It's not a quick fix.
Yeah, absolutely. I would say a lot of people, they come in physically and mentally very rigid, where they are stuck in their ways. They've maybe been in pain for a lot of their life. They've had the same habits for a lot of their life, and they're very rigid where they just want to be out of pain. And it's just, their mindset. But I think our goal and what, to answer their questions, trying to get them to be more pliable and, like, again, no pun intended, but physically and mentally, where, things happen throughout life. And like you mentioned, it being a lifestyle, you need to be able to be comfortable with unknowns in the future by being pliable and knowing, well, I've been taught all these great tools. I can take control of my own health. So it's never just like a thing where, well, I can just stop and go back to the way things were and I'll be hunky-dory forever. Because that's not how it works. You are what you do. And so you really need to be pliable, and knowing that being consistent, I think, is a goal in and of itself, that people want to attach, specific goals, which is great, but sometimes just being consistent doing something is huge. So directing people to be more about their mentality around their lifestyle and habits, I think, is even more important sometimes than a specific, end result outside of that.
Yeah, that's a really good point. And also, I think, pain is a good motivator, right? It's uncomfortable, it hurts, you can't do the things you want to do. And so for most of our clients, that's what gets them in the door. That's what gets them seeking help. But understanding that was just the alarm from your body, right? Like that was just the signal to get your attention, and it did, and you came and you sought help. But once you're here, I think a great part of the process, like to Paul's point, is like learning to be consistent, but understanding why, and having the tools that apply specifically to your body. So it's not like just this general stretching program. You come in, you get this education on like why the movement patterns that you've had probably for decades have led to this alarm going off, this pain and discomfort, which then, stopped you from doing the things you wanted to do. So when you kind of put the pain and put that alarm aside and you realize like, okay, that's just telling me that we've gone too far, and you're working with your therapist, and, we use functional tests, which is basically movements or positions, and they could be anything. Like they're not just specific to our clinic, but a functional test can be being able to go for a walk around the block, So a test of the quality of your movement. So if you do yoga, if you work out, if there are still imbalances, but there's no pain, like if you still have a tight side, but a flexible side, or you have a weak side and a strong side, or the side you can balance on, like if those things are still showing up, then there's still work that needs to be done. So the consistency matters because you want to be able to move with quality. And like Miranda said, that's going to translate to quality of life, injury prevention, being able to do all the things you want to do. So yeah, like the lifestyle thing is huge. And, we hope that our clients really understand that through the process. And sometimes it's like you were saying, Paul, I think it's like a mental switch, right? Like just kind of staying committed to something and making that decision of like, okay, this is now part of my life. I brush my teeth because I eat every day. If you want to move your body every day, then do your menu. Like if you don't want to hurt, do your menu. If you want to be as flexible as you can, do your menu. If you want to be as strong as you can, do your menu. Like the list can go on, right? Like if you have a body, do a menu, basically is what it comes down to.
Yeah. The word you kept saying that's so relevant is the process, where it's so great to be goal oriented, but sometimes it's about the journey and the process, especially when, in this case, your health is a journey that never ends. So people are so much about, getting things done, getting things fixed, and then moving on. That's just, you can't get out of your own body. So it's really about, like you mentioned, just doing a menu, even if it's the smallest thing, but just having that habit formulated where, you're in this for the long haul, because like I said, you can't escape your body, and you eventually, unfortunately, people, they fall back in just habits that got them there in the first place. So it really is as much a mentality as much as it is physical, because your thoughts invoke your actions, and if you fall back in the same even thinking patterns, then your actions will follow in place too. So process is what it's all about.
Yeah, absolutely. And like new clients, I think, like Miranda, what you were saying, like you get this question a lot because they came in the door with pain. It's like, okay, I'm not in pain anymore, so do I have to keep doing this? I think like one of the things I do like to elaborate on early in the therapy process is like, okay, like this is our projection, right? Like I know you're in pain right now. Absolutely, we want to get you out of pain. But along the way, we're going to be making these discoveries of what got you here. And most of our clients end up needing us like less and less and less, right? You usually start seeing us once or twice a week. And we're kind of like in it together. And we're like, all right, let's figure this out. Let's get you out of pain. Let's get you more functional. And then you, as the client, start to get more confident. You start to understand your body better. Then you have accumulated all these tools, right? Which is your exercises. So like we want to see you become self-sufficient. We want to get to the point where it's like, okay, when I feel that my back is tight, I know these are the exercises that help me, and I don't have to go in for an appointment because I know what to do. Like that's what we want, right? We want you to become self-sufficient. And then at the same time though, you have us as a resource. And so like I tell new clients, like a lot of our clients, it's like a lifetime relationship. Like doesn't mean I'm going to see you once a week forever, but the communication, the support, like the access to us, like we're here. We're not going anywhere. Like you can call us, you can email us, set up a random one-off appointment if what you're not able to do on your own, because life happens, things happen. So I just like to set up that projection where it's like, we're going to be very consistent in the beginning, like with you, kind of holding your hand through this. But then let's get you to the point where you got this on your own. Like we want to empower you to do that.
Yeah.
Yeah, definitely. I mean, I definitely say the same thing to my clients, and I'm sure Paul says the same thing to his clients, is kind of set up that foundation in the beginning. And then, I like to use like little analogies here and there, like maybe in the, because again, the goal is to, as much as we love to see people, you don't have to rely on coming in or doing a Zoom appointment or whatever every so often, but maybe you have to come in and think about like bringing your car in for an oil change, just kind of like a little tune up here and there as you need it. And that's where, and then again, the education piece that you were elaborating on a lot, Elisa, is just kind of like, we focus so much on explaining everything we do in order for our clients to be able to understand what's going on with our body when they do get to the point where they're not seeing us regularly.
It's really exciting when that happens. Like I love when I start to talk to a client and I'm like, all right, sometimes it happens on accident where it was like, oh, they couldn't make it to a session and now it's been like 2 weeks since I last seen them. But I know in the back of my head, like at the point that we are in their process, they should be okay for 2 weeks without an appointment. And then like checking in with them and I'm like, okay, 2 weeks on your own, how did you do? And they're like, you know what? Like I changed one of my exercises because I felt like I needed this instead of that. I'm like, yes, this is music to my ears. That means you're getting it. You understand your exercises. You understand your menus. Like, I think we could start spreading out your appointments now. Like it's like a little graduation for them.
It's very like, it's a great like warm feeling, especially even if they just want to like dive into like deeper things than what we're teaching them too. I feel like that like kind of like building on that kind of relationship when they, you know, feel comfortable enough with not seeing you and you can trust them, but then they ask like extra questions, you know, about like the anatomy and what's going on. I feel like that's also a little like,
Yeah.
great.
Yeah, it's like when they get to that point, it's not what happens to you, it's what you do with what happens to you. So when you're at that point, do you lean on your resources like your therapist? Do you take the knowledge and confidence you've gotten from what you've learned to use the tools that you've been taught when you have, you know, a setback or you feel something later down the road? Do you lean on that, or do you go back to what you're maybe doing before and you go back into that fear mentality of, well, I got to back off, I can't do anything anymore, and then you just, you know, run away and isolate yourself. So that's what we try and push them toward, is being confident in their resources and what they have in their toolbox to take control of their health when things come up. And so it's just what you do with what life throws at you and being able to confidently kind of navigate the waters, because that's what life is.
Very well said.
Absolutely.